What is typhoid fever? Typhoid fever, also known as enteric fever, is caused by a type of bacteria called Salmonella. This disease is rare in places where few people carry the bacteria, where water is treated to kill germs, and where human waste is managed properly. For example, typhoid fever is rare in the United States. However, it is more common in parts of Africa and South Asia and poses a serious health problem there, especially for children. Typhoid fever can be contracted from contaminated food and water or from close contact with someone who carries the bacteria. The symptoms include high fever, headache, stomach pain, and either constipation or diarrhea. Most people start to feel better about a week after beginning antibiotic treatment, which helps to kill the bacteria. Without treatment, however, there is a small chance that complications from typhoid fever could be fatal. Vaccines are available to help protect against typhoid fever, although they do not provide protection against all types of salmonella. Nonetheless, getting vaccinated can reduce the risk of catching typhoid fever. What are the symptoms of typhoid fever? Symptoms of typhoid fever typically start slowly, often appearing 1 to 3 weeks after exposure to the bacteria. In the early stages of the illness, common symptoms include a low fever that gradually increases throughout the day, potentially reaching as high as 104 degrees Fahrenheit, 40 degrees Celsius. Other early symptoms are chills, headache, weakness, fatigue, muscle aches, stomach pain, diarrhea or constipation, and a rash. People may also experience a cough, loss of appetite, and sweating. A few weeks after these initial symptoms begin, the illness can cause more severe problems in the intestines. People may suffer from intense stomach pain, a very swollen stomach, and sepsis, which is an infection caused by gut bacteria spreading throughout the body. In very serious cases, individuals may become confused, unable to focus, and unresponsive to their surroundings. These complications can be life-threatening. Additionally, some people may experience a return of symptoms up to a few weeks after the fever has subsided. What are the causes of typhoid fever? Typhoid fever is caused by a bacteria strain called Salmonella enteric serotype typhoid. Other strains of Salmonella bacteria cause a similar illness known as paratyphoid fever. People often catch these bacteria in areas where outbreaks are common. The bacteria leave the body through the stool and urine of infected individuals. If people do not wash their hands carefully after using the bathroom, the bacteria can spread from their hands to objects or other people. The bacteria can also spread from a person who carries it. It can be transmitted through food that is not cooked, such as raw fruits without a peel. In places where water is not treated to kill germs, people can become infected by drinking untreated water, using ice made from untreated water, or drinking unpasteurized milk or juice. What are the complications of typhoid fever? Complications of typhoid fever include intestinal damage, bleeding, and leakage, leading to severe pain, vomiting, and sepsis. Other complications include heart inflammation, infection of blood vessels, pneumonia, pancreatitis, kidney or bladder infections, and meningitis. Psychiatric issues like delirium and hallucinations can also occur. These complications are life-threatening and need urgent medical attention. How can you prevent typhoid fever? To prevent typhoid fever, vaccination is recommended, especially for those in high-risk areas or planning travel to such areas. Access to treated water and proper waste management help avoid contact with Salmonella enteric serotype typhoid bacteria. In the U.S., 2 vaccines are available for those aged 2 and older, administered as a single shot or orally in capsules. Since vaccines offer incomplete protection, follow these guidelines when in high-risk areas. Wash hands frequently. Drink only bottled or treated water. Avoid raw produce washed in contaminated water. Opt for hot foods, and know where local healthcare providers are located. How can you prevent spreading typhoid fever? To ensure others' safety while recovering from typhoid fever, take antibiotics as directed, wash hands frequently with hot, soapy water, and avoid handling food until no longer contagious. Testing may be necessary for food handlers and healthcare workers to confirm they aren't spreading the bacteria. How is typhoid fever diagnosed? Your healthcare provider will use your symptoms, your travel history, and lab tests to diagnose typhoid fever. They'll give you a physical exam and listen to your heart and lungs. It's very important to tell your provider if you've traveled recently or think you've been exposed to typhoid, otherwise they might not know to test for it. They'll also use the information to decide what treatment to give. What is the treatment for typhoid fever? Typhoid fever is treated with antibiotics. However, some newer strains of the bacteria can survive antibiotic treatments. This means you may be given different antibiotics based on the type of typhoid you have and where you got sick. Paratyphoid fever is also treated with antibiotics. If you are severely ill or have complications, you might need additional treatments and may need to be admitted to the hospital for proper care. How does typhoid fever spread? Typhoid fever spreads through contaminated food or water, often due to poor hand hygiene after using the bathroom. Bacteria from feces can contaminate surfaces and objects, transferring to others when touched. Does typhoid spread by kissing? No. Typhoid doesn't spread by kissing. You usually don't get typhoid fever directly from another person, but you can get it if you touch something they've touched if they don't wash their hands after going to the bathroom.